Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Metro Orthopedics and Sports Therapy in Silver Spring, Maryland, discussing ACL injury diagnosis and treatment and how these injuries can occur and the latest treatment options with one of this region's top orthopedic and sports medicine specialists, Dr. James Gilbert. Dr. Gilbert is the head team physician for DC United's pro soccer team, as well as the team physician for the U.S. national soccer team. Welcome, Dr. Gilbert.
Thank you for having me.
Oh, it's our pleasure to have you on our program. We've got a lot to talk about regarding a very important topic, namely ACL injuries. They're very common, obviously, occurrence in sports. A lot of folks get them every year, unfortunately, because it's very painful. And I wanted to have you begin by please telling us, for those out there that are watching that may not know what the ACL is.
ACL stands for anterior cruciate ligament, and it's the main ligament within the knee, and its function is for neuroproprioception. It helps the brain understand where the knee is in time and space, and it keeps the knee stable.
And can you please tell us how the mechanism of injury occurs within the ACL that can cause that to obviously tear, for example, that happens to a lot of folks who play sports?
Certainly. Contrary to what most people might think, it's usually a non-contact injury where an athlete's suddenly changing directions. So the body's kind of going one way and the brain's thinking it's going the other way. And that creates enough force by the athlete's own muscles to overpower the ACL.
What is the most common injury that you see here at most? Is ACL area the most prevalent as far as the injury to that specific region?
Well, in my practice, ACL injuries and surgeries on ACLs are probably the most common operation that I do.
Okay.
And it's growing in incidence. It's a lot more common, actually, in females than males, probably 7 to 1.
My goodness.
And so I see a lot of female soccer players, especially with ACL injuries.
Now, you see, I didn't know that. I would never have thought that. 7 to 1 ratio, my goodness, more women than men.
We feel you can actually retrain the way women run and make them run a little bit more like males. And we've shown, there's a lot of studies that have shown that you can decrease the incidence of ACL injuries, especially in women, by doing pre-season conditioning ACL prevention protocols.
How would you diagnose the ACL injury? What takes place?
Well, it's diagnosed based on the history that the athlete gives the physician, the exam, and then we will use imaging studies such as an MRI to help us make the diagnosis.
Now, from what I found in my research, Dr. Gilbert, and please correct me if I'm wrong, I found that a lot of times when folks tear their ACL or have an injury in their ACL, they're not really aware, other than some pain, that they may have a torn ACL. In other words, they can still walk, from what I understand, in many cases. Is that correct?
You know, the ACL's function is really for, doing high athletic movements like sudden acceleration or deceleration. So everyday activities such as walking, an athlete might function fairly well.
Yeah. So for the folks out there who may actually have this injury and may not be aware that they have it until obviously they push themselves, then they'll find out that they have something wrong with their knee, what would you tell them as far as some of the typical symptoms that they should be aware of?
Right. Well, giving way is probably the most common complaint, giving way with athletic activities.
Is surgery the only option when it comes to treating ACL injuries, or are there others?
Well, in a young athlete, it's pretty common standard to treat it with surgery. In my medical opinion, it's really not an option to treat an ACL deficient knee without surgery. And the problem is that it's every giving way episode can cause damage to the articular cartilage and the meniscus, the brake pad in the knee. And we have some solutions for that if it occurs, but it's not perfect. So to prevent rapid degeneration and accelerated arthritic changes, we really need a stable knee. And thus we would strongly recommend in a young, active individual that the ACL be reconstructed.
I wanted to ask you if there are some advances or treatment options that you can educate us on when it comes to the ACL injury and how to effectively treat it, obviously with surgery, that is, let's just say, an advancement to what used to take place years ago.
That's a good question. I would say that the biggest advancements in ACL reconstruction over the last 10 years have probably been in the increased use of allografts. Allografts are cadaver tissue, and what's really made it possible to use those on a more regular basis is the fact that we can gamma radiate them and get rid of any chance of infection, or almost make it non-existent. And in addition, we can store them and implant them and secure them in an efficient manner that we couldn't do 10 years ago.
Yeah, we used to hear about the infections back then. They were a lot more prevalent than now, and that's a big reason why.
With allograft reconstructions, we're finding that it's a quicker recovery, and that they're working just as well as an autograft, which is tissue taken from the athlete. And you know, so that's probably been a big advancement over the last 10 years. But also recently, and on the horizon, you're going to see accelerating the healing process with growth factors, things like platelet-rich plasma or stem cells that we can inject or administer to actually accelerate the process, kind of like putting fertilizer on your grass as you're trying to grow it.
Yes. No, those are some great points. You see some pro athletes that are taking the platelets, for example, the platelets-rich plasma that you just touched on, as a way to expedite that healing and come back quicker, and it's showing some very good results.
Well, it seems like we can get athletes back a little bit quicker, but also we can make stronger, more resilient grafts.
Yes.
But in addition to those aspects, I would also say, you know, rehab protocols have improved as well, and we're being a little bit more aggressive. We understand the biology and the pathophysiology of a graft that's healing better than we ever have. So we now understand that actually putting forces and load on the knee in the rehab process earlier on actually accelerates the healing process and makes it a more resilient graft.
All right, and as far as results for the viewers that are watching, you just touched on it. You're looking at more treatment options, a lot more effective, you know, coming back sooner than before. Infections, obviously, very minimal now as opposed to what was available and happening 10, 12 years ago. So numerous benefits from the advancements that have taken place.
I like to think that we can cure ACL disease. You know, it's really the other associated injuries around that ACL event that we're still working on.
We're now going to meet some patients of most. Hi, Emily. How are you?
I'm fine. How are you?
Oh, fine. Thank you. It's our pleasure having you on today on our program as a guest. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Emily, I wanted to begin, if I may, by asking you what problem or problems were you experiencing with yourself that brought you here the most?
My knees. I had a fall at work on my knees, and they started bothering me, and so I was recommended to come to most.
So you had both knees or one of the knees?
Both.
Oh my goodness.
Yes.
They were really starting to affect you and take their toll as far as pain, things along those lines?
Yes.
Oh boy, so then you came here to most, and what happened?
I got surgery on the right knee first, and I had, well, I started therapy first, and then it was really bothering me. So they did the arthroscopic on it, and in October, and then I went, the left knee, after I went back to work, the left knee started bothering me. So I had the same thing done there.
Okay.
And then while I was out on the left knee, the right knee started bothering again, so they had to go in and realign the bone. So they broke the bone and realigned it.
So what happened after that?
Well, I went to therapy, and therapy is the best. I recommend therapy for anybody that has to, do the therapy. It was like I was in real bad pain, so they worked with me and eased the pain up that I could go back to work. So on the last surgery now, I'm going through therapy so that I'm getting ready to do light duty on going back to work next week.
Very good. And how do you feel about the results?
Oh, I love it. I love it here.
And for all the viewers out there that are watching, obviously you're very pleased with your experience at Most and with their staff, I take it.
I am. I would recommend anyone to come here. I recommended a couple of people. I don't know if they're here yet, but I did recommend them to come here because the PT workers, they are excellent. And the doctor and his assistant that I have, I just love coming in because I get my satisfaction each time that I come in.
I understand they treat everyone like a family member.
Oh, they do.
They really take great care of you.
Yes, yes they do.
Well, on that note, I'd like to thank you, Emily, for joining us and being a guest in our program.
Oh, you're welcome.
Welcome, Scott.
Good morning. Thank you. Thanks for having me.
It's our pleasure to have you on as well. I wanted to begin by asking you, as I did with Emily, what problem or problems were you experiencing that brought you here to Most?
Well, back in August, I had an accident at work, trying to assist a passenger, and stepped wrong, ended up tearing my left knee.
Oh my goodness. So you also had a knee problem.
Oh, yes, sir.
And when you say you tore it, I take it like torn ligaments,
That's
ACL?
actually my medial meniscus tear.
Okay.
And I came to see Dr. Gilbert, and Dr. Coble assisted me.
Okay, and what happened once you got here then?
When I got here, they've been very professional, very courteous. They diagnosed my problem and got me into surgery right away. And I've been coming here basically doing rehab to try to get back to work as soon as possible.
Doing the therapy and
Yes, sir.
everything else?
Yes.
And as far as, did you have much downtime or not?
Oh, well, like I said, this happened back in, I had surgery back in August 25th, so hopefully I'll be going back to work in the next couple weeks.
As far as the viewers are concerned, what would you tell them about your experience here with Most, Dr. Gilbert, and the staff?
Like I said, my overall experience for me personally has been excellent. Like I said, Dr. Gilbert, Dr. Coble have been excellent. Very efficient as far as the diagnosis. In this instance has been a workman's comp situation, so the staff's very knowledgeable with how workman's comp works out, so they got the process really done quickly. And like I said, the physical therapy staff's been excellent as well. So.
Well, I'm happy to hear that. You certainly seem very pleased with the results.
I am. Thank you.
And on that note, I'd like to thank you as well, Scott, for joining us and being a guest on our program.
Sure, thanks for having me.
Our pleasure. Welcome, Linda.
Thank you.
Oh, it's great to have you on as well on our program. And I wanted to begin by asking you, what were you experiencing and going through as far as difficulties, pain that brought you here to Most in the first place?
I started off with some arthritis in my right knee. I also had a problem with an ACL that my leg was sliding out of joint or out of place as I was walking or moving or getting out of a vehicle.
Oh my goodness, so you were definitely going through a few major problems there.
Major problems, yes.
So what happened? You came here, did you see Dr. Gilbert or somebody on his
I
staff?
saw Dr. Alejandro,
Okay.
and we tried a couple different things first to see if we could solve it without having to do the surgery, and finally determined that we had to do a total knee replacement.
So then you had the knee replacement.
I did on May 16th.
Okay, and then what happened after that?
After that, they had a very detailed therapy program set up for me. I come to therapy 3 times a week here.
Just so we have an understanding of what takes place in some of the therapy treatments here when it comes to knee problems. In your case, what was the therapy like and what did you do basically?
I requested, number one, that they be very aggressive. I'm an active person.
Okay.
And so we start off with different things like leg presses, Russian stimulation, squats, bends, a multitude of a variety of things. And then as time goes on, they increase the difficulty, the amount of weight that you have on you, weight bearing, things like that.
So you just build up as you,
Absolutely.
and obviously that rehabs your particular problem as far as the recovery is concerned, and you wanted a more aggressive therapy treatment
Absolutely.
option.
I'm an active person.
Yes.
I play a lot of sports. I drive a school bus for Montgomery County.
Okay.
So it was important that I got this knee rehabbed quickly and got back on the road.
Wonderful. And for the viewers out there that are watching, what would you tell them about your experience here with Most and the staff?
Oh, wow. What an excellent group of people, very professional doctors. They try probably everything they possibly can before they even take the option of surgery. And I don't know who hires all the therapists, but they're a wonderful group of people.
Well, I think that says it all right there, Linda.
Thank
And
you.
on that note, I'd like to thank you for joining us and being a guest in our program.
Thank you very much.
What type of a rehab process should one be aware of that they'll be looking at?
Well, physical therapy and rehab is a critical part of getting a good result. And some of the things that are new out there are use of Ultra G treadmill, for instance,
Okay.
where we can start weight-bearing activities at a sooner point in the rehab process. So the Ultra G machine is a weightless treadmill, so we can dial in the amount of weight-bearing load that we want. So we can actually get athletes running and doing sport-specific activities much sooner on in the rehab process. And what we're learning is that it's it's really a rewiring process. So once you put the ACL in, we got to wire it to the brain, and by doing that through our rehab protocols, we've gotten quicker and better at doing it.
Well, that's certainly good to know, Dr. Gilbert. Now, we've only got a few moments left, and I wanted to ask you before I let you go. You and your organization, Most, here in Silver Spring, Maryland, certainly have developed a reputation for excellence in sports medicine, orthopedic surgery, even with Teresa on the wellness component for women out there. You really have a comprehensive organization. You've got a great reputation. You're obviously, as I mentioned before, the head team physician for DC United soccer team, among many other major responsibilities that you have. What would you say really helps separate you and your practice apart from some of the other organizations out there?
We utilize a team approach to taking care of the athlete, and so it's not just one provider. It's a lot of different brains and energy going into making an athlete better. And we like to think that our goal is to not only get an athlete or an individual better, but to bring him to a different level.
Yes, indeed. The patients that we've interviewed are all testimonials for that, and our research has borne that out. You all really care about your folks here as well, the patients. It's like a big family over here at your organization. Everyone really cares for each other. You guys do a great job. You're on the cutting edge, and you really have enlightened us on your particular area that we've discussed today with ACL injuries and the treatment options that are available. And on that note, I'd like to thank you, Dr. Gilbert, for joining us and being a guest in our program.
Thank you for having me.
It was our pleasure.